Lung cancer claims the lives of more Americans than prostate cancer and breast cancer combined. Lung cancer is one of the easiest cancers to prevent, according to Dr. Raymond-Casciari of St. Joseph Hospital in Orange.
Lung cancer is a disaster. If you look at all the deaths from cancer in this country, more people die of lung cancer than die of any other cancer. And it is, for some reason this isn't well publicized, but more women die of lung cancer than die of breast and colon cancer combined. And more men die of lung cancer than die of prostate and colon cancer combined. It is the #1 killer in this country. Preventing lung cancer is an interesting thing, and the short answer is, don't smoke. Unfortunately, that's not the total answer. About 85% of lung cancers are caused by smoking or smoking related in some way. But there's all sorts of exposures that can predispose you to lung cancer, and then there's some folks that get lung cancer for no apparent reason. The atmospheric or environmental sorts of things that cause lung cancer would be exposure to asbestos. Cadmium workers get it, but probably the most common is people exposed to radon. So that's probably the #1 cause of non-smoking related lung cancer. Then of course you have the smoking related lung cancers, and that is the #1 cause of lung cancer. So the prevention, the best thing you do, don't ever start smoking. The symptoms of lung cancer are shortness of breath, coughing up blood, unexplained weight loss, sometimes pain. Sometimes lung cancer can present with a sign of spread, like spread to the brain or spread to the liver. But unfortunately, once you get to those symptoms, it's probably too late. What we're finding now is that we can do spiral CT scans, and we can pick up very early lung cancers. And if we can pick up a lung cancer that's less than a centimeter, there's a 85% cure rate. So that's like very, very encouraging. So I've been encouraging all my smokers to get these spiral CT scans done because it's saving lives. There's no doubt that it saves lives. At St. Joe's, we have dedicated chest surgeons. We have surgeons who do nothing but chest surgery. And they've been a tremendous boon to therapy and to making the diagnosis. We can do mediastinoscopy. We can do video-assisted laparoscopic surgery where you can actually put a scope into the patient, and there's 3 tiny incisions. And through that scope, you can biopsy the lesion, and you can also remove the lesion. So this is a tremendous advance. The interesting thing about St. Joseph's Hospital lung cancer program is it's a very good kept secret. Nobody knows about it. We have doctors who are practicing here. We went and looked at our data for the last 5 years. It turns out that if you had lung cancer at St. Joseph's Hospital, you had a better chance of survival than you did at well-known hospitals across the country, and a much better chance of survival than the median survival across the country. So our program is excellent, but it doesn't have the reputation of a lot of other places. So what we're trying to do is we're trying to build the reputation of the program so more people who live around St. Joe's and are in our primary service area recognize the excellence of this program and demand to be treated here.